Next, I request our speaker, Dr. Sudhakar Prasanna, who is going to give us excellent talk on standardization of the approach, therapeutic approach to autism, and the reason why we fail.
Good morning, one and all. This whole session, Dr. Amalraj chairing is a autism session, and an unique thing is the organizing chairperson, secretary, treasurer, as all into that autism, and we all three covered autism along with Sweta madam actually. So this is not a scientific topic. This is a social approach and practical approach based on the science I learned so far. So why we fail in autism management? The answer is we don't have that standardized approach. So first question, can we go with a pessimistic approach? We fail. But the problem, the increasing prevalence of autism as per the CDC 2023, it is 1 in 36, alarming rise from 1 in 44 just 2 years back. So we have a responsibility more. We are not supposed to fail. We are not allowed to fail in these things. That's why I selected this topic, why we fail in autism management. Next. So, am I right person to talk about this topic? First question, when we say something failure or success, we have to question ourselves whether I am the right person to talk about it. Yes, I feel I have failed in many times, so I am the right person to talk about the failures. So, in 2010, I joined the development neurology course, then we developed a development module, then we did workshops, then I started my own multidisciplinary approach therapy, then started training school teachers, then I developed a comprehensive autism program on my own based on the ESDM, then ABA course. So why I put is, so whatever I learned is through this journey of more than 13 years, I learned and slowly started realizing I have failed in many times. So I was really confused where I am failing. So analysis, so throughout the 13 years of journey gave me some insight about it. That's what I'm going to share with all of you. So age of diagnosis. So very, very important. We all know theoretically we can make a diagnosis of 18 months, 2 years or 3 years. But 18 months, yes, you can make a diagnosis of autism. You can suspect an autism by even 1 year. But still we are not making it. So the age of diagnosis, the first problem we come across in many settings, even in Western countries, those who are given charts, the thing is approximately they diagnose by the age of 4 years. In Indian study, the latest Indian study, Dr. Supriya Bhavani, Dr. Shafali, all those people are there. This diagnosis says 18 months to 14.25 years and median of 42 months, that is 3.5 years. Yes, my own experience also that parents when they come to me, they usually come between 3 to 3.5 years. So based on the theory of neuroplasticity, you have to start as early as possible. You have to start before it established. That's what Dr. M.K.C. Nair talked is rehabilitation, not rehabilitation. These chapters are development, pediatricians should be more concentrated in the rehabilitation, not to do the rehabilitation. So the age of diagnosis clearly gives an idea that we have to make early diagnosis and start the therapy early. It gives a rehabilitation, it prevents a lot of things actually. And another thing, unique thing of autism children is they are considered to be a neurotypical children. Many times we taught wrong things. They learn the wrong things from our own interaction. Now it is like learning and unlearning. After 3.5 years, I am going to say, Baba, you should not do like this. You should do like that. But who taught him everything? To want some milk or something, they will be pulling your hand or doing something. I gave milk and everything. I taught the child that this is the way you have to communicate to me. At 3.5 years, I say, no, you have to ask me milk. Amma, palta. But by that time, the child already learned. It is like unlearning is very difficult. Learning may be easy, but unlearning is very difficult. So we are also responsible for, so age of diagnosis really matters. So this is the curve. So age of initial, that's a study based thing. So approximately 32. It arounds the 25 to 40 months. Then age of diagnosis. This is parental concern. Parent themselves, they will have doubts, but they won't come to us. Then age at diagnosis, time to diagnose, I will discuss. So why we delay the age of diagnosis? Many times we come across these things. We felt that he is physically fine. No one can say by looking at him, yes, it is the most important thing in autism. The children looks normal. Because we look at physical things, we look at cognitive things. They are very intelligent. They are smart enough to take the things from us. What we miss is social communication. That is not evident for us actually. We are not aware of that. We think only a child is intelligent enough to get things from us and running, jumping, everything. That's what for development for us. But it is not that. They said the father also did not speak till the age of 5. He now is into engineering, successful, first division. Only the mother knows the pain of these things. She might have married to a well-earning engineer, but there is no social communication, no love sharing, everything. Many families are going like this actually. So second thing is recognition of behavioral and developmental concerns. We have to say, for parent, it is a speech delay. Many times we also consider as a speech delay. It is not the speech delay in autism, it is a communication delay. So you can say, if there is no anything, the speech therapist is giving a speech, teaching her phonics, whatever it may be. But what is this? Communication. What is the difference it is? Speech is just communicate with words. I can do this in online. Why physical program are better than online? There is no communication. Non-verbal communication is not there. You don't know what is my emotions. So non-verbal communication is very essential for the success of life and socialization. So you can see if the words will be there, the eye contact is there, the emotional sharing is there, the bonding is going to, the child is going to learn a lot, where the child is going to learn just words. So time to diagnosis, that's a very important thing. Lack of awareness of age appropriate child development milestones apparent amongst the community, health and educational professionals contributed to a 1.5 year delay between the parental concern and autism. It's a really painful thing. Many times after coming to a diagnosis, the parental concern and the diagnosis, it took more than 1 year. Many times parents come to us and we talked about autism and everything. After 1 year they come back again with and say, yes sir, whatever you said is right. I accept my diagnosis, your diagnosis. But there is a very big delay. We have lost the valid period. So the wait and watch, as a pediatricians, we have a responsibility to stop talking, wait and watch. Whenever there is a delay, it is a delay. There is no point of talking to wait and watch. Whenever there is a speech delay, don't give an assurance that male child talks later, 3.5 years, isolated speech talk delay. You are not a master in it. We are not all master in it actually. In my clinical experience, I have come across that any speech delay will have been associated either ADHD or autism or communication problems or at least in a learning disability in the later age group. So a speech delay should not be taken as a speech delay. It is a diagnosis of exclusion. So disempowerment of mothers and lack of, there is another social factors, very social. For 99.999% of the mothers will go through that. Mothers are the one to first suspect, but forced to consider as a normal from the family members to the extended family members. It will goes on like that. All will give in all kind of advices, only to postpone the things actually. And finally the mother will be labeled as an overthinker. So the lack of unity, see coming to some parental side, diagnosis, everything, now you are coming to the things, very important thing, lack of uniformity in the treatment process. What kind of treatment process we have to go through is, we can say behavioral approach, developmental approach, educational, social, relational, pharmacological, psychological and complementary. So which one are you going to choose? Because we have a lot of therapists now. You can see a lot of occupational therapy centers. For autism means OT. That's what for every one of you come across. Autism, first thing comes to my mind is an occupational therapy. Next, speech therapy. Now, as per the American Academy of Pediatrics, the first standard of therapy is ABA. Behavioral approach is the applied behavior analysis, and developmental occupational therapy and speech therapy. Educational is a teach method, and social and floor time, that's one of important. Pharmacological, yes, we all do accept drugs are meant for, not meant for core symptoms of autism, but it is useful in co-occurring symptoms or comorbid mental health illnesses. So we cannot say no to everything, but we have to analyze whether there is having any co-occurring symptoms. Psychological, cognitive, many you have cognitive, CBT. CBT is a process, I never advise CBT in a child with, CBT is a process making you to think about yourself, analyze your problem, and then you do a self-management. It is more for self-management. I don't expect any autism. It can happen in adolescent autism or adult autism, not with the children. Then find the complementary. Do you want to say no to everything? Science is an evolving thing. Better no, sir, don't say no to anything. Tomorrow we also may accept music. We don't know. But only thing is document it. If the mother is coming to say, I am following a diet, I say explain it. But I don't say you should not do that like that. And she will say you should not treat my child. So the thing is, accept it, but tell her this is the science, there is no much evidence now, let us follow it. You follow, we have other kids are following that, we can compare with that. So that scientific evidence we can teach the parents also. This is what I am practicing in my clinic. I said, no, na paal kudukamata. It's okay, it's up to you to decide. But I have another children who are drinking milk and chocolate. You just analyze, observe it. If it is happening, improvement is happening for the child, now you can understand, you can also try that. But this is the way it's helpful for us actually. It is more of like an inclusive. So duration of therapy process is another very big challenge. Considering the cost of the therapy, many times parents will come for therapy for like 45 minutes, weekly 3 times, that's all. And they goes up. Many times the doors are closed for the parents. So what is happening inside, we don't know. So therapy process like 45 minutes so together means 2.25 hours per week, concluding 10 hours per week. But the point is, of course, 1 is better than 0, 2 is better than 1, 25 is better than 2, 40 is better than 4. So studies has clearly says 25 to 40 hours of therapy every week will be divided across several days in the week matters. Many studies have come out that 40 to 42 hours, they supported 40 to 40, that means 6 hours per day in 7 days. Is it practically possible? Just imagine the cost of therapy, availability of the therapist. Is it possible to 6 hours a day at 7 days in a week throughout the life? Not possible. So what is the solution for that? So go for the domains of therapy. Another important thing, we restrict ourselves to the speech and everything. The child should be seen as a holistic approach. A child should be going to social approach, adaptive, language, cognitive, executive. The child will be literally lacking in all these things in an order. They may be problematic in social, yes, that's the topmost problem. Then the adaptability, adaptive, then language, cognitive, executive. They may be good in gross motor, but they may be lacking in the fine motor. That play, everything is very important. Look at child with all these 8 points in the therapy. And lack of continuous support. This is another important. The child will be performing everything in the center. And our therapist will be worshipped as a god, including myself. Because I am talking as a doctor, a pediatrician, as well as a behavior therapist. Many times people worship me like, you are like a god, you are like a magician or something like that. I know what the trick actually. So if I perform the trick, it's like a magic, it will happen. But magician is not a god, it's a trick. Same thing with a certain system, reinforcing system and everything, I know I want to make a child to talk to me. But is it going to happen? But that is not the point. The child is not going to live only in my center. The child has to perform. So what we are preparing the child, it is for the academy and it's for the socialization. So the child should be able to apply that in a social environment. Whatever I learn in the center has to be applied in the social environment. We call it as a generalization process. So I teach something, the child should have that concept, learn the concept and go to the society and able to apply that process in a novel place, novel situation. That's where I became successful. So, but here, see, many times children with autism never have problem in family. They never had any issues. They don't show much challenging behaviors in the house, but because they have trained our parents. See, we all think we train the children, but most of the time children train us. They kept under us control. See, if say, then the mother will come and take something. When he goes near the window and hold it, and mother will understand he has passed urine or toilet. So he is simply communicating, there is no problem because mother is there always to attend the thing. So there won't be any problem. But the child when says, when he is not able to mingle with the play, he will be irritable. See, again and again we say autism children are considered to be a normal child with a communication problem. Because he is not able to communicate, he get irritable, excitement, anything he couldn't communicate, he will show the challenging behavior. For me it is a challenging behavior, it is not for the child. It is just a behavior of, it's a communication by the child actually. So we need to teach the siblings, we need to, whenever the social setup, we need to expose the child to the social setup. Many times in marriage we avoid, certain parents avoid taking the autistic children to the marriage program. Because he may get a hyper sensitivity for the noises, he may not like lights and everything. No, we have to expose to them repeatedly. And the family members should not show any pity for that child actually. Then school setup, we don't have that. India is lacking almost like 0 to 0.1% or 1% of our school support system for autistic children. Of course, thankfully, many schools started taking children of inclusive education. It's a very good welcome improvement, but still what is happening after that? I took the child in the classroom. What is going to happen for the child? If I am running a school, I get money something, I include the child. But what is going to happen for the child as now? So we need a support system called shadow teaching. It's almost like 0 to 1% in India. That's one area we all have to concentrate. And failure to involve parents and family. This is the most important reason for failure of therapy in autism. 99%, painfully I would say that 99% of therapy centers close the doors for no reason or unknown reason or unintentional or intentional, I don't know, but the doors are closed. Speech therapy say if the mother is there, it's getting distractible. So the child is where the child is going to live? Is in a closed room or an open area? The child is going to learn in the open with the 40 children, one crying, one jumping. The distractibility, yes, the child has to learn in spite of this distraction, everything. We have to prepare a child like that. So the mother should know how to handle a child when he is showing the behavior problems. So what is the therapy? I already told. Now I am connecting this hours of therapy. Is it possible for me to give a therapy? Not possible. So let me empower the mother. Let me teach the mother. That skill is not very easy. Your mother is not going to be a competitor to open a center. I know for 13 years experience, I know it is not easy to start a center. To run a center is the most challenging in my life actually, running a center. Keeping everyone together. Lot of ego issues will come up. We have to shut out that. You have to play and sometimes you will also get burst out. But still again you go and apology to your own team of people, taking like a family, making them to understand the importance of autism child, not our own egos. So a lot of things. So we have to involve the parent, we have to train the parents, the mother should become the therapist. She is the best therapist in the world, she is the best pediatrician as per Nelson also. So not only the mother, the father, many times 90% fathers don't come to the therapy center. But you have to involve. In our centers, parents, fathers also come inside actually. So fathers also at least once or twice a week they have to come to that center. Then very importantly, grandparents. Whenever a mother is providing therapy, that another spoiler or we call it an extraneous variables or confounding variables we call that. See, a party will be doing something in between and spoiling everything. The child will be beautifully learning from the mother, party side and she will be spoiling everything unintentionally. So she has to be taught what is the therapy actually. So the next is the resource availability and socio-economic conditions. Of course, we have 37 district early intervention centers under the RBSK scheme in Tamil Nadu. Happy about it. Autism children get 1 lakh through CMCHS. Happy about it. But do we have the therapists in the DIC centers? That's a very big question. We are not able to get a clinical psychologist RT for the amount they are paying actually. So DIC system, I am as a government servant, I am not supposed to say it is a failure, but I don't know, I know what is happening. So it is not to blame a government. It is a system, it's a model. See, we cannot blame a government. Government cannot blame the 140 crore population. It can give a model which is successful. We have to learn from that, we have to practice it actually. So creating therapists, training the parents, making a early diagnosis, and another thing is, another one thing, after I have 20 seconds, socioeconomic factors, yes, and once you start creating a parent training centers, yes, we can resolve it. After Chennai, I don't find much autism centers out of Chennai, after Chennai. So these are the things, we have a very big challenges. So it is not the child fails, it is not the autism fails, it is not the autism management fails, it's all, we all fail in providing what is the right thing. It is the right time, it's just I want to, it's not for, so we have people who work together, it is like it is not an advertisement, just to say OT, it is possible. Just I want to show that it is possible. If you talk to people, explain it, your OT therapists are ready to accept it, your speech therapists are ready, psychologists are ready, they all work together. See, that's initially we started as a multidisciplinary, then they moved to interdisciplinary, now the approach is transdisciplinary. All understand the science, all understand, applied together makes a complete treatment. So for every child, every right. Join the journey to bridge the gaps. Thank you for, and I thank my teams.
Thanks, Dr. Sudhakar. You clearly highlighted that failure is the success, is the stepping stone for success. This topic is a scientific topic. More importantly, it is an emotional topic also, because we have seen a lot of families, broken families, once that this diagnosis is being broken. Many parents telling, "Thalaiல இடி விழுந்த மாதிரி இருக்கு சார்ன்ட்டு." So we see a lot of problems. That is a different aspect. And I think all the four speakers, Dr. Sujata, Dr. Sudhakar, Dr. Subramani, and Dr. Meenakshi, they have taken the topic close to our hearts. And as pediatricians, if we follow all those key points which they delivered to us, we can make wonders in the life of these children. Thank you.
Professor Srinivasan sir.
I want to tell, you have done such a wonderful talk and also wonderful thing. With listening to you, I think there will be no failures. So wonderful, thank you. Of course, as is correctly mentioned, all the four people kept us totally into the talk, and such wonderful talks, you know. So I'm sure they are all lucky, those who are here. Thank you so much, it was very nice. Thank you.
Thank you, sir. That made the day for the organizing team of GDBPCON.